Madam, as we were talking about the development in the government medical hospitals, similarly, do you find it a bit competitive to fight with modern equipments, high-end technologies for the patients, for the treatment with the government hospitals?
It's a very nice question, and I thank you for asking me this question, because one point I would like to state here, that CAPEX, that's capital expenditure, is a huge burden to the private hospitals. And we have investors who are investing in the private hospitals, but it is a huge investment. Now, the government hospitals have equally equipped machineries, but again, as Dr. Jaiswal said, that it is the manpower and the human resource which is also a very, very valuable part of it. Adding to that, I would like to bring into this forum is that how do corporate hospitals can be a little less, expensive. That is, the fixed cost, which is a burden to the corporate hospitals, actually the governments can help us to subsidize certain things, because we are an industry. We're trying to be an industry which is a healthcare industry and getting a recognition post-COVID, where a lot of things are not subsidized. Our lands are not subsidized. We have a huge burden on the holding taxes. We have a huge burden on electricities. Even biomedical waste is also which we need to pay for the disposal. So if these fixed costs can be taken care, like the government hospitals don't need to pay for this, I'm sure it can help the patients as well as the corporate hospitals and the entrepreneurs who are setting up the new corporate hospitals.
Okay. Dr. Rohit, adding to that, as Nilanjana madam said, that corporate hospitals are now actually in a position of competitiveness, because there is a development in the government hospitals. So to maintain that quality, the private sector hospitals or the corporate hospitals also to be in the run have to such quality treatments. So not only with the government hospitals, but many private hospitals are coming now. So to maintain the quality of such corporate hospital is now also a challenge for such thing. Do you really agree to this?
No, definitely. It has to be agreed upon, and we have set standards. We have come out with various accreditation processes where we are weighing the output of the healthcare providers, like the NABH, NABL, ISOs, so that we have to maintain. And the push is also from the quality think tanks of the government, so that we have to adhere to it. But unfortunately, this is only being implemented maybe because of the commercial, but I would say that this should be done for the government sector also. But the government sectors are doing it. I am not denying. Earlier it was no NABH for the government sector, but now they are also coming up and doing it. So at least from the output part of it, both from the outcome part of the healthcare, both are at the same level. But you must understand that if we are talking about affordable healthcare for both, I think some time back there was a survey in which per bed cost of a government hospital was much more than the private hospital, because of the dead weight which the government sector takes it. And the technology will be same. Now here the industry also has to play a big part. You see, the technology mainly is imported. It is from the outside, and it's a cost which is expensive. So the industry also will have to chip in to be more collaborative, to be more supportive, rather than only doing business out of it. Okay. So that will take care of the cost both in the government as well as in the private.
Okay.